Hi, Dr. Barker here at Peak Plastic Surgery. So here we get a question a lot of how long does a fat transfer last, whether it's the glutes or the breasts, but specifically today we're going to be talking about breast fat transfer. So when you think about a fat transfer to the breast, there's a lot of components that go into it, and there's a lot of components that go into it to an expectation of how long it will typically last. So when you come in for your consultation with me, I'm going to go over specifics with you about not only your breast anatomy. What is the makeup of the breast? What are the position of your breast? What do we expect for a change in size, shape, contour, all of those kind of things. But when you get down to the nitty gritty and actually talk about how long is a fat transfer to the breast going to last, the short answer is it depends on the patient. When you really want to get down into it, it really depends on multiple things. The first thing I always look at with my patients is what is the makeup of their breasts? Is it mostly fat? Is it half fat, half fibrous type of material? Is it mostly fibrous? What is the position of your breast right now? What is the size of your breast? All of these things come into play on how long is that transfer of your body's fat to your breast going to last. The next thing we talk about, what is the modality that we use to harvest the fat, clean the fat, and then re-inject the fat. So here at Peak Plastic Surgery Center, with me, I only use Vaser liposuction. Now, there's a lot of misnomers out there with Vaser because it gets hot, because the ultrasonic frequency probe will also heat. But if you do it at the right setting and the right amount of time, it actually does liquefy the fat to a bit, but it does not denature the fat, meaning the fat is still totally viable and actually makes it much easier to inject, which also makes it much easier to layer and also allow for that neovascularization or new blood vessels to grow into the fat. I also use what's called a pure graft system. This is what I use to harvest the fat into to clean it, to make it purified. I found in my hands, this is the best way in order to get the most pure fat. So when I inject it, it doesn't all absorb. On average, it's about 60% of the fat you inject into an area, also comes into play with the breast, stays. The other 40% is resorbed by your body. What I see here, typically about 60 to 80% of our fat stays, only about 20% or so goes away. That is a short-term answer, however, because long-term, how should it last? With how we do things here with my patients, you can typically expect years of the results to stay and be in pretty much the same place. However, when you think about time, you also got to think about gravity, natural aging. All of these also come into play. Everybody does that differently. The third thing that I like to talk to people about is weight loss, weight gain. Your lifestyle does matter. If you gain weight, you may not actually notice much loss of it because you're also gaining weight everywhere. But once you lose it, that's when you'll start seeing major changes, but you see that in your breast regardless. So when you go back to the original question of how long does a fat transfer last to the breasts? Again, the short answer is it depends. The long answer is it depends on your surgical technique, depends on the fat quality and what you're taking and how well it's cleaned. It depends on the breast anatomy, where they're sitting, what is the composition of the breast, how old is the patient, how long are we expecting this to last in different age groups. Everything comes into play. So to wrap it all back up, how long does a fat transfer last to the breasts? The answer is it depends on the patient. That is why you need to come see a surgeon that will talk you through the entire process, expectations, and realistic timelines. Every patient is different, which is why I give a different answer to every single patient. It's so important to come in and chat with your surgeon and figure that out. But you can expect at least a couple of years minimum if it is done correctly and you maintain your lifestyle as it is now. If it is different after that, you need to come back in and chat with your surgeon and see what happened and if something can be done about it. But again, here at Peak Plastic Surgery Center, we do love doing customized approaches for our patients. So I will go over this with you in depth and explain what you should expect for your breasts and what you should expect the outcome to be. Again, any questions that you may have on that, let me know, and I'm happy to answer.